Hello, I'm Dr. Ken Landa. Thanks for watching. Let's talk about Valtrex or Valacyclovir. This is a treatment for herpes simplex virus infections, oral or cold sore type herpes or genital herpes. And it also is good for shingles or the herpes zoster. It was approved initially in 1995, went generic in 2009. It actually is a prodrug. It has to be converted into the body into the active form. So when you take the Valtrex is not something that's floating around in your bloodstream. The Valtrex is converted into acyclovir. The difference between taking plain acyclovir or Zovirax and taking the Valtrex is when you take the Valtrex, the bioavailability is about 3 to 5 times greater than if you took just simply the acyclovir. And that means you have to take the dose less frequently. The drug acts to prevent viral replication, which prevents viral spread, which facilitates healing. You can take the drug either with or without food. When we talk about bacteria, we talk about antibiotic resistance. So some antibiotics aren't any good because they've been used for a long period of time. What about Valtrex for the herpes? It's been used for a long time. Is there any resistance of the herpes virus to the Valtrex? Only a smidgen, and it doesn't seem to be very important. Now, if you're going to take the medicine, you have to take it as soon as possible after some symptoms begin. Typically, it's even before the breakout. Well, the virus lives inside the nerve. So the overwhelming majority of people who have outbreaks of virus that already is present either in the back of the head or in the spine near the genital region. And when the virus starts to grow and starts to come down the nerve, it irritates the nerve to some degree. And when it does that, it causes what we call prodromal symptoms: itching, burning, pain, numbness, tingling in the area. That's when you want to start taking the pill. If you wait until the cold sore is present, until the bump is present, the papule, the rash, the ulcers on the skin, you're actually too late, because the virus, if we look for it, is at its highest concentration right before the attack begins, not afterward. Afterward, the viral titer rapidly decreases, so that if you take the Valtrex and the sore's been there for, say, 24 hours or more, it's not going to do you any good. There are several different doses that people take for these recurrent episodes. One of the common ones is 500 milligrams twice a day for 3 days. Call it the 1-2-3 treatment. You also could take 2 grams initially and 2 grams 12 hours later. That would also be sufficient. There's no benefit taking it for a longer period of time. If you do take the medicine as soon as possible, then the pain is going to go away about 1 day sooner, and healing is going to occur in 4 days versus 6 days if you didn't do anything. Remember, you have to take the drug at the earliest possible time. Now, some people know when they're going to get an infection. There are certain triggers. So you spend too much time in the sun, or you're stressed, or you're fatigued, or the area is traumatized, or you have a cold or the flu. That's why we call it the cold sore. Well, some people might actually want to take the medicine prophylactically around that period of time. It also is important that you keep the medicine at home. So if you have a history of recurrences, you want to make sure that the doctor has prescribed extra, because you don't wait until you can get an appointment or call the doctor the next day and then maybe take some time to get to the pharmacy. That's probably not going to be very helpful. Now, in spite of the fact we take a short course therapy for recurrent virus, sometimes people get the initial attack. Now, most people who have the initial infection are not going to have any symptoms. They're not going to know that they've been infected. That's more than 95% of the people who get the herpes simplex virus. A small percentage of them will have primary disease, and primary disease is associated with elevation of the body temperature, a rash on both sides of the center of the body, both sides of the mouth or all around the genitals. It's a relatively severe infection. For those individuals, treatment should begin within 72 hours of the onset, and the treatment continues for about 7 to 10 days. If we want to suppress the virus, because you've had multiple recurrences, if you've had just one attack or 3 attacks, we tend not to use suppressive therapy. But if you've had more than 4 to 6 infections per year or recurrences per year, either of the oral or the genital type, then we begin suppressive therapies. Suppressive therapy works well, but it's not a panacea. So if we look at people who are taking 1 gram a day of Valtrex as suppressive therapy, and we follow them for 6 months, only half of them are going to be recurrence-free. If we follow them for 1 year, then only 30% are going to be recurrence-free. So just because you're taking the medicine doesn't mean you will not develop the infection. It also is important to realize that if you were taking a dose of acyclovir 400 milligrams twice a day, probably that would be as effective for suppressive therapy. Sometimes people get herpes involving the eye. The medicine might be somewhat helpful, but you do need to see an ophthalmologist. Now, the number of outbreaks a person gets, especially in the genital herpes, resolves around whether it's the herpes virus 1 or the herpes virus 2. If it's the herpes virus 1 in the genital area, even though most people think of herpes 1 as just around the mouth, well, it's not. If we consider what happens when you're infected with the herpes virus 1 in your genital area, chances are you're going to have fewer than 1 recurrence per year. On the other hand, if it's the herpes virus type 2 in your genital area, chances are you're going to, at least initially, on average, have about 4 to 5 attacks a year, 4 to 5 recurrences a year during the initial several years. And then as time goes by, the number of recurrences is going to dramatically decrease, whether or not you're taking the acyclovir, whether you're taking the Valtrex. Now, it's very important to realize that healing is relatively quick, as I mentioned, but if you happen to have that primary infection, it's going to take a lot longer for it to heal. So you're not going to stop shedding the virus for about 3 days. The pain isn't going to go away for about 5 days. And the lesion isn't going to heal for about 9 days. As I mentioned, you have to take the antiviral, you have to take the Valtrex for a longer period of time. Valtrex is not a cure for genital herpes, nor is it a cure for the cold sore type herpes. You have to realize that most transmission is going to occur when there is absolutely nothing wrong with your skin. You can look down there, you can look around the mouth, you don't see anything, you think it's safe to kiss or do whatever. You don't know. You absolutely can't tell. Most people who have been infected do not know they're infected. And as a matter of fact, you can have a long-term monogamous relationship with someone, and all of a sudden you can develop an outbreak. You don't know whether you caught the virus from the individual you're currently having relations with or somebody 10 or 20 years ago or 30 years ago, depending on your age. And you also have to realize that Valtrex does not prevent transmission of any other sexually transmitted disease other than perhaps the herpes. Genital herpes is a condition that about 20% of the population has, even though most people are not aware of their current state. But if we do antibody testing on large numbers of people, 20% are positive for the genital herpes, and oral herpes is present in about 50% of the population. The good news is that over the past decade, the number of infections has dramatically decreased. Well, that brings up the idea about prophylactic treatment. Is it a good idea, if you've never been infected, if your blood test is negative, should you go and take Valtrex to prevent getting infected? Well, actually, there's no evidence regarding that particular question. However, we do know that if you're having relationship with somebody who has had herpes and you've never had herpes, well, what happens if we suppress the virus in that individual? Let's say we give that individual 500 milligrams of the Valtrex, and we give them 500 milligrams of Valtrex every day. We follow them for 8 months. Now we look at you. What's the likelihood that you are going to have an attack of genital herpes? The likelihood is 75% less if that person is taking the Valtrex than if the person is not taking the Valtrex. While 75% seems very impressive, the 75% means if the person's not taking it, your chance of getting the virus is 2 to 2.5%. It's only about a half of 1% if the person is taking the Valtrex. Seroconversion, you're getting the virus but not knowing that you're infected. Well, if your consort is taking the Valtrex, your chance of becoming infected is about 1.5%. It's about 3% if the person is not taking the Valtrex. So suppressive therapy seems to be somewhat helpful, but not nearly as helpful as most people believe. If we look at people who are taking suppressive therapy, the data is really only for about a year in immunologically normal people, maybe about half as long in people whose immune system isn't working well because maybe they have HIV. The likelihood of genital herpes overall, if we're looking at people between the ages of about 15 and 20, is about 1%. In people in their 20s, it increases to about 7.5%. People in their 30s increases to 10 to 15%. People in their 40s increases to about 20%. Now, the prevalence increases with age, and it's more common in women than it is in men. Now, if a person is tested and is test positive for herpes simplex 2, that probably means the person has genital herpes because for some reason genital herpes or the herpes 2 virus doesn't seem to be around the mouth very often. On the other hand, the herpes simplex 1, the one that most people have traditionally associated with cold sores around the mouth, well, with a change in our sexual habits over the period of the past 20 years, now the likelihood is about 50-50 that your genital herpes is going to be herpes virus type 1 or herpes virus type 2. Should normal people get tested for herpes simplex to see whether you're at least potentially contagious or at least you might get the virus? The government has studied that and says, you know, testing really isn't all that it's cracked up to be. Let's not do it, so it's not recommended. However, it's important to realize that for the overwhelming majority of people, we can't tell who infected who. That just can't tell. If we look at the shingles virus, the likelihood of benefit of taking the Valtrex for people who have shingles or herpes zoster, well, if you take the drug within the first 72 hours, it seems to be effective. Now, in some people who are developing blisters for longer than 72 hours, the drug might be effective as long as new blisters are in the formation stage. Unfortunately, while the shingles may heal more quickly, it does not appear, repeat, does not appear that Valtrex has anything to do with the amount of pain you suffer or the likelihood of developing post-herpetic neuralgia. The varicella zoster virus that causes the shingles also causes the chickenpox. Chickenpox is a disease that we don't see all that frequently anymore, so there haven't been a lot of people treated, but it's thought that the Valtrex will help people who have the chickenpox. If you have any of these type of herpes virus infections, you don't want to touch different areas, you don't want to spread it. You certainly can spread the herpes simplex virus to your eye or to your fingers or to other areas. If you use a condom, is that adequate prophylaxis? Condoms only work about 50-50 because a lot of people have the cold sore virus, whether it's genital or oral, in areas other than what's going to be covered with a condom. If a woman is pregnant, there's a special issue. If the woman develops the primary infection while she's pregnant, that's a major problem. On the other hand, most women develop the recurrent attacks. And if a woman is going to develop that recurrent attack, remember that by the time you see something, the titer of the virus on the skin is markedly reduced. So what's the role of cesarean section? It's arguable, certainly up for discussion with the obstetrician at the time. In the pediatric population, the drug seems to be effective. There are no interactions with other drugs. If a woman is pregnant, she can take the drug, doesn't seem to be a problem. In women who are breastfeeding, actually it seems that the antiviral, the Valtrex, is concentrated in the breast milk. If a person has some degree of renal impairment, it's important to make sure you're consuming sufficient fluid so that the drug doesn't crystallize inside the renal tubules. Side effects with the drug are minimal to non-existent. Some small percentage of people, probably about the same number with the placebo, complain of headache or nausea or abdominal pain. Rarely there's a change in the liver function, and very infrequently some people, especially older people, especially with renal problems, can complain of vertigo, dizziness, confusion, swelling, constipation, or maybe some agitation. But sometimes, especially in elderly people who have decreased renal function, there is some agitation and some confusion and occasionally some hallucinations. It's important to make certain that those people are not being treated excessively. And additionally, in people who have underlying immunologic abnormalities, then sometimes the drug is associated with some severe blood-related disorders we call hemolytic uremic syndrome or thrombotic thrombocytopenic purpura. Those are very, fortunately, rare, but they are very serious. Well, when you take the drug, it's rapidly absorbed. When it's rapidly absorbed, it's converted in what we call the first pass metabolism in the intestine and the liver. It's converted into the acyclovir. The amount that's bioavailable is about 55% versus if you were just to take the acyclovir by itself, only about 10 or 15% would be bioavailable. It's important also to realize that the medicine isn't in the system for all that long. It's cleared through the kidney and through the intestines. It works on an enzyme that's necessary for the viruses to replicate their DNA. Fortunately, the drug seems to work much better on the viral thymidine kinase than it does on the human thymidine kinase. So there aren't a lot of side effects. Now there is an issue. It seems that the herpes simplex 2 is more sensitive to the Valtrex than the herpes simplex 1, and it also seems that the naturally occurring shingles virus that would be present in people born prior to the time we began using immunization, well, that's more sensitive, the older kind of virus, than the strain that we use in the vaccination for the varicella. However, a person should not get the varicella virus vaccine and be taking the Valtrex. Same sort of situation with the older shingles vaccine. The older shingles vaccine had that same kind of chickenpox virus in the vaccine. Obviously, should not be taking the two together. Now, the new medicine called Shingrix, that doesn't contain any live virus, so there's not an issue. You also have to realize that you can take all the medicine you want, and if the virus is latent inside the nerve, it's not going to be susceptible to the killing effect of the Valtrex. It doesn't do anything to virus that's hiding in the nerves. And the good news is that the price has come down drastically since the drug went off patent. You can buy 6 of the 500 milligram pills. The cash cost at Costco, no insurance, $13. If you go to Walgreens, it's almost $50. The coupon price, if you get a coupon, say, from GoodRx, anywhere between $5 and $17 for a course of therapy. If you got the Valtrex, the name brand, instead of the Valacyclovir, the generic, would be $80 to $85. Now, if you had the shingles, you need a higher dose. So you take 1,000 milligrams and you take it for 7 days. The generic cost of that at Costco would be $46. At Walgreens, it's $243 cash, but if you get a coupon from GoodRx, no cost, then the coupon price for the drug would be anywhere between $19 and $72. If you went and tried to buy the Valtrex to treat the shingles, at that dose it would be almost $500. Now, just as a comment on the craziness of the drug pricing system, you've heard the prices of these drugs. Well, if you buy the acyclovir, the generic acyclovir, very cheap, dirt cheap, even cheaper than the Valtrex, but they have a new medicine called Sidivig. Sidivig is acyclovir that you can use as a buccal patch. You put it on your mucosa in your mouth, and it helps. The price for that, for one round of treatment with the coupon, the discounted price, is $1,000. So the good news is Valtrex or Valacyclovir, it works, it's good, it's effective, it's inexpensive, it doesn't have a lot of side effects associated with it, doesn't interfere with other kind of drugs. You can take it under almost any circumstance. It can be used as a treatment just for the prodrome, you have to keep some at home, or it can be used as a suppressive therapy on a regular basis. Works in all of those instances. But remember, you have to be a little bit careful about your sexual activities because you don't want to get the virus in the first place. Unfortunately, right now in the United States, we seem to be on a downturn as far as the incidence of infection is concerned. So we're doing something right. Anyway, thanks for watching. I'm Dr. Ken Landau.